Hello, and welcome to another session of Digital Slide Review and Sign Out. I'm Dr. Louis Hassel, and our program, again, the product of a collaboration of the Digital Pathology Association and Path Presenter under the auspices of the Digital Anatomic Pathology Academy. Our case today is one of those unusually encountered GI lesions. A 55-year-old woman has an incidentally discovered mass in the body of the stomach. It doesn't have a mucosally evident lesion, and so the presumption is that they're dealing with some sort of a mural tumor, most likely a GI stromal tumor. Their attempts to biopsy using FNA or forceps were relatively non-productive, and so the patient came to resection. On resection, we see a tumor, and we'll flip this around so that we can see properly oriented. Here we can see it nicely located right within the muscularis propria. We have an intact mucosa, and we're probably here in the body or fundus. We have a submucosal zone, and then we have this slightly exaggerated muscularis propria extending over this more bluish tumor. And we note at low power that it has some vascularity and some white spaces in it as well. As we look at higher magnification, we see that this number of nuclei must be relatively high to the amount of cytoplasm given its slightly bluish or purple appearance. We should note these cleft-like spaces here and recognize that those are not just an artifact of fixation or sectioning. And also note here the rather vascular nature of this lesion at the periphery with these dilated spaces, some of which here appear to be totally surrounding nests of tumor cells, potentially with some measure of intravascular growth by this lesion. So as we've come into higher magnification here, we can see that these cells have, rather than being spindle-shaped, they tend to have rather rounded nuclei, fairly low-grade appearing, slightly clumped chromatin, peripherally located, a little bit of central clearing. And so we might wonder then about a neuroendocrine lesion because of this round nuclear appearance and the relatively low-grade and uniform appearance of these nuclei. And that's frequently presents as one of the differentials for this tumor. Another thing we might consider is, of course, a GI stromal tumor with an epithelioid or round cell appearance. Those tend to still have a little bit more cytoplasm than this, and to not have this prominent vasculature that we've noted here. Or to have these cleft-like, slit-like spaces that we see here branching in several areas. We might wonder because of that about things like a hemangiopericytoma, like solitary fibrous tumor or something like that. And so the differential considerations as we approach the immunohistochemical workup would include those types of entities. A paraganglioma might also enter into the differentiation in light of the sort of packeting or rounded nodularity of some of these areas. In reality, this is a wonderful example of a glomus cell tumor, as indicated in the title. These tumors have a prominent vasculature, can have intravascular growth and extension, and may be mistaken on biopsy for neuroendocrine tumors, solitary fibrous tumors, or GI stromal tumors. We've commented that this usually involves the muscularis propria, and although it's uncommon in the stomach, it is a recognized site of occurrence. The immunohistochemistries, of course, that would be useful with this are calponin and actin or H-caldesmon. But these tumors would usually be negative uniformly with desmin and S100, certainly with chromogranin or synaptophysin, and usually also with CD34, although a little bit variable in that behavior, in that fact. Vascular invasion, as we saw, is frequently encountered, but interestingly has no relationship to behavior. Most of these behave in a benign fashion. but sometimes you will get metastases, and occasionally they can also present with life-threatening hemorrhage if they're not treated. But it's difficult from the histology to predict metastasis. So it goes under the generic rubric of tumor rather than carcinoma or other types of malignancies. So our final sign-out diagnosis today, glomus tumor of the stomach, a very characteristic case. I hope that you'll take the minute or two to come back to the presentation and look at the digital slides. The link to those is located in the description below, and that's a useful way to study on your own this lesion and become more familiar with it. I hope that if you like this, you'll subscribe and share it with your friends. We welcome your comments and hope that you'll join us again for another brief vignette in GI pathology. Thanks very much.